Good evening, everyone, and thank you for coming to our latest Ask the Leaders Facebook Live Q&A. My name is Councillor Cllr Runciman, and I'm the Executive Member for Health and Adult Social Care and Chair of the City's Health and Wellbeing Board. The Council's held a number of Facebook Live sessions now, covering a range of topics from the latest public health advice to business support and guidance. Today, we're joined by experts on public health and finance to answer your questions and to discuss what the latest restrictions mean for residents and what support is out there to help us get through this uncertain period. Before we meet the panel members, I'd like to firstly wish you a very happy new year and thank everyone in the city, residents and businesses alike, for all their efforts in keeping the city and each other safe. This year has certainly not begun how we would have wanted it to, and it's clear that the next few weeks and months will be difficult for us all. None of us want to see further restrictions on our lives, but it's crucial that we stop the spread of the virus alongside the rollout of the vaccine. I know that a lot has been asked of us all, and we're very grateful to everyone for their hard work. As we've done since the very beginning of this pandemic, the Council will continue to do all we can to make sure residents, businesses and communities are supported through this difficult time. We will also continue to make the case to government for increased financial support, both to local businesses and to households on low incomes. Our community hubs are still up and running, and anyone needing support can contact our helpline. It's 01944 551 550, or you can email them at COVID in capitals, covid19help@york.gov.uk. And our incredible volunteers and staff will be there to help you. If you need assistance with collecting shopping or prescriptions, or simply need advice on what the restrictions mean for you, they can help. As well as looking after our physical health by practicing hands, face, space, we must also look after our mental health too. Anyone needing support can call our helpline, and I would encourage everybody who can to exercise. Getting exercise, ideally daily in the fresh air, can make a real difference to both your physical and your mental health, and will help make these coming weeks more bearable. This is a tough period for us all, but please look after each other and check out on friends and families and neighbours if you can. With the vaccine rollout, there's hope on the horizon, but we've got to pull together to get this through once again. Now I'll ask the panel to introduce themselves. Can I ask first Councillor Nigel Ayre?
As Chair, Councillor Nigel Ayre, I'm the Executive Member for Finance, Performance and Major Projects.
And now Pauline Stuchfield.
Good evening. I'm responsible for the Council's Welfare Benefits Service and for the distribution of advice and financial support around COVID-19 grants for residents and businesses in the city.
Thank you. Dr. Mike Holmes.
Yes, thank you, Carol. So I'm Mike Holmes. I'm a GP at Haxby Group practice in York, but I'm also chair of an organisation called Nimbus Care, which is where all the GP practices in the city have come together. And I'm the lead clinician for the mass vaccination site at Askham Bar. And I'm also the vice chair of the Royal College of General Practitioners.
Thank you, Mike. And finally, our Assistant Director of Public Health. She will introduce herself and then give us an up-to-date overview of the current situation in York.
Thank you. Yes, hello everyone. I'm Fiona Phillips. I'm the Assistant Director of Public Health for City of York Council. And I'm sure most people have been kind of following the news and watching how the sort of pandemic has been progressing over recent weeks. And will probably be aware that we have seen nationally an increase in the number of cases across the country, but this has also been what we have seen play out within the City of York. So as of today, the validated 7-day rate of cases for the city per 100,000 stands at 627. Now, that has been a significant increase over the Christmas period. Really, we started to see that rise happening really about the week before Christmas and has continued to steadily rise. At the moment, unfortunately, I can't say that we're seeing any downturn in those number of cases. Obviously, we went into a national lockdown on the 5th of January, but we probably will not start to see any impact of that lockdown in the figures that we have, I would say, for at least another week. So it isn't a very positive situation at the moment in terms of the number of cases that we're seeing, but what we have seen when we've been in the situation of lockdowns before is that they do work and they do have an impact. So we do expect to see that we will see a decrease in cases. It's just that there is that time lag, because we know that the incubation period, the time it takes for the infection to develop, can be anywhere between sort of 10 and 14 days. So unfortunately, we're not seeing that reduction yet, but the sort of positive hope is that we will start to see that come through in the next week or so.
Thank you, Fiona. And now can I ask Fiona and Mike the first question, which is about vaccinations. There's been a lot of talk online about vaccinations. Perhaps I can start with Mike and then Fiona. How long will it take for them to be administered to the most vulnerable? And is there a timetable for it?
Yeah, thanks, Carol. So people will have noticed, I think, that the vaccination programs have started across the city. As I mentioned earlier, all of our GP practices and their primary care networks, which are groups of practices working together, have joined forces to try to deliver vaccines to our population as effectively and as efficiently as possible. So at the moment, we've got 2 sites that are running. So Haxby Group practice have run some clinics at their surgery for their over 80s patients, but the large site at Askham Bar is now underway. That started the week before Christmas. We've made really good progress in terms of vaccinating our over 80-year-old patients, and I think we're well over halfway to vaccinating everybody in that cohort. So hopefully by the end of next week, we should pretty much have got through most of those patients. We're also vaccinating patients, residents and staff in care homes. And my hope is that by the end of this week, we should have got through the majority of those with only a very few left to do. So I think we're making really good progress. You know, the timetables that the Prime Minister has set out by suggesting that we should vaccinate everybody over the age of 70, everyone in care homes, housebound and health and social care staff by mid-February is not unachievable for us. I think we're well on our way. There's going to be additional capacity put onto the Askham Bar site over the next week, and the more astute of you who've been passing that site this week will have noticed huge cranes on that site, and we've been working with local businesses like Porter Cabin to put modular buildings on the site to increase the capacity, and more information about that will emerge over the next few days. So lots of activity, lots of people working together, and we're getting through the list. And I think what I would add to that too, and you'll have seen this in the news over the weekend, is that our hospitals are creating vaccination hubs as well. And York Hospital is no different. They're working with us. I spoke to their teams on Monday, and they're now providing vaccinations for health and social care staff across the region. So it's a real full system, full community effort to get this task done and protect you as quickly as we can.
Thank you, Mike. Fiona, would you like to add to that?
I think the only thing that I'd want to add, obviously, as Mike said, it is a huge programme and it's an amazing piece of work that colleagues are doing. From a public health point of view, just to add that the vaccine is safe and that people shouldn't feel worried about having the vaccine. The only thing that we would caution people about, and we've heard on national news of various scams, so just people being aware of any scams. As Mike's explained, Nimbus Care have been responsible for rolling this out, so communications that come via Nimbus Care or from the NHS are okay, but if people are getting spurious contacts from anybody about the vaccine, just to be aware of those.
Thank you. And Fiona, can you answer the question about testing? We've been asked who's eligible, and I wonder if you could make that clear for people.
Okay, so in terms of our testing within York, so obviously if people have any symptoms of COVID, then the testing that you can access by booking online and going to either the Poppleton Bar drive-through or the walk-in site still stands the same. That hasn't changed. What we are doing across York with the introduction of the technology around lateral flow testing, which is the rapid test that you get a result within 30 minutes. That's what we've rolled out more recently for York. And really who's eligible for that testing now is basically anybody who, because of their job, cannot follow the advice to stay at home. So we should all be staying at home, working from home if possible, but obviously for some people that isn't possible. So if that is you, you can book via the council website to have a lateral flow test. What we say is that we recommend that, it's not a one-off thing, so it should be something that you see as part of your usual routine, and if you can have 2 tests a week and keep on top of that, that's what we'd recommend. We've also been testing secondary school pupils who having to go to school because they're children of key workers. So if you have a child that falls into that group and they haven't been tested, they can come forward to that test site to be tested as well. And we are looking to expand that capacity. So currently we have sites at the University of York and York St John. We're also looking at potential other sites to increase our capacity as well, and we will also look to potentially expand that to younger age groups, and not just the secondary school pupils. We'll look at the primary age range as well. So it's quite a fast moving thing that we're developing, really. So keep an eye on that website and how you can book on for tests.
Thank you, Fiona. Can I go to Pauline now? This is about grants. We've had a question come in about grants for hospitality from Chris, and we've had questions about other grants for people told to self-isolate. Pauline, could you have a look at those, please?
Yeah, so in terms of the business grants, if businesses have claimed grants before under the lockdowns and when we were at tier 3 and even tier 2, you really don't need to apply again. We will be making payments automatically. If you are new to claiming a business grant, and all of the details are on the council's website at york.gov.uk, some of those grants we're still waiting for information on, and certainly discretionary grants, we're making decisions on those next week, but certainly the hospitality grants, if you've applied for those before, you don't need to apply again. In terms of test and trace grants for people who have to self-isolate, there is a £500 grant payment that can be made. It's a one-off payment, and the timescale for this has been extended till the end of March. We were notified of that today. It was due to end at the end of January. To be able to apply for the scheme, you must be employed or self-employed. You must be unable to work from home and will lose income as a result of self-isolating. You also need to be on one of the following benefits, which is universal credit, working tax credit, income-based employment and support allowance, income-based job seekers allowance, income support, housing benefit and pension credit. But we do have a funded discretionary scheme as well, so don't let that put you off. And to be eligible for a discretionary payment for us, you must be a resident of the UK, have capital or savings or shares of less than £16,000, have a normal weekly gross income between £80 and £280, and have a reduced income solely because of the isolation. And we know many people fall into this category. And then provide some details of your circumstances during self-isolation. What I would say is that many residents and businesses are experiencing short-term and long-term difficulties, and we have a huge amount of information on the council's website at york.gov.uk. And if you're confused by which benefits you can apply for, we have lots of information on the website at york.gov.uk/benefits advice. And there's also a very, very useful website called from the Money and Pensions Advice Service, who give advice across all a range of impacts from COVID. It might not just be financial, it might be family worries, it might be mortgages, buying houses, or any other difficulty that people may have during this very difficult time. So I would recommend that website as well.
Thank you, Pauline. Nigel, can I ask you, there's been a lot of talk about councils being really slow to get business grants out. Is that the case in York?
I think there certainly has been a lot of conversation around that, and it's not always been accurate. So I think councils have been at the forefront of making sure that these business grants have been able to get into the hands of businesses. And I'm pleased to say that when the first round of grants were announced, that York was in the top 10 in the country in terms of their ability to get that money out to people. So it really was a lifeline and really testament to the work that our staff have put in to enable them to get them out. And I think following on from some of the comments that Pauline made, I think we're trying as much as possible with the new sets of grants to make sure that the system is simple, smooth and quick to make sure people can get those out. So as Pauline said, any businesses that have already applied for the grant don't need to apply, and our staff are busy working through at the moment to get in touch with those and start to get some of those funding out. It has been a massive challenge. I think during the process of this pandemic, we've had 8 different schemes, I think it is, that we've totaled up that we've had to administer. And I think over the last 5 weeks, some businesses have been entitled to up to 5 different types of grants, depending on the periods that they've been in tier 2, periods they've been in tier 3, periods they've been in lockdown, whether they have certain retail hospitality, wet grants, for example, was one of the latest ones that did. So we do ask for a little bit of patience from businesses. It is a very complicated and an ever-changing landscape, and we are getting through things as quickly as possible. I think, as Pauline said, a lot of businesses will be waiting to find out where the latest set of grants has come through. We're hoping that we'll start to get that money through from central government by the end of this week, and hopefully have some level of guidance in terms of how we can do that and get those out to people as quickly as possible. Urge people that they sign up to our business bulletin to get some of the more up-to-date information as we start to put that one out on a regular basis. The FSB, Chamber of Commerce, Make It York, York Bill, etc. are all fantastic channels where they can start to get that information, and obviously social media and local media. And I think we have always been aware, and we were very aware as a local authority at the very beginning of the first lockdown, that the support the government was offering doesn't cover anyone. We were one of the first to recognise, I think, what's now become known as the excluded 3 million. We did step in very early in the pandemic to put our own money as a local authority, over £1 million available for that. And we were very glad later on that the government followed suit and added to that one. We do now have the additional restrictions grant. We did come up with the criteria for that at the end of last year to sort of help some of those businesses that weren't receiving the official support. We are reflecting on that, as Pauline said, and there was a decision session of mine coming on the 18th of January, where we'll be looking at those businesses that have received support from that additional response grant, those that haven't, and look at how we can tweak that with some of the additional funding that we've got. I'd say we'll continue to work with businesses and partners to try and make sure that we're protecting livelihoods, protecting jobs, and trying to maintain our strong business community.
Lovely. Thank you very much, Nigel. Back to Mike now. We've got a question coming in from Jason, and it's quite complicated, but I'll try and summarize it. And it's about the gaps between the two vaccinations. And he's saying, I'll see if I can just read it to you. Give me a moment. He says, can I ask what the balance is between the second dose for extremely vulnerable people and the first dose for the next level? Will they run in parallel, or will the first dose be put on hold when the second dose is administered? And do we have any timeframes for that?
Yeah, so this is a really helpful question, Jason. So thank you for that. Obviously, over the last week or so, what we've heard is that we've moved from a period of 21 days between the first and second vaccination to a period of 12 weeks. And the reason for that is because what we're hearing from the scientists involved in this is that the first vaccination gives people up to 90% protection from COVID, and the second vaccination perhaps only an additional 5% protection. So government policy has shifted to a place where we want to vaccinate as many people as possible with their first vaccine before moving on to the second dose. And so what this means in York is that we will be doing first dose vaccinations for the first 12 weeks of this program. So just to put that in perspective, I was vaccinating 80-year-olds at the beginning of this week, and their second dose is being arranged for them at the end of March, beginning of April. My hope is that if the vaccine supply is where we would like it to be, which I've no reason at this stage to suggest that it won't be, then we could potentially vaccinate all of the JCVI, that's the Joint Committee on Vaccinations and Immunisations Priorities groups in York within 12 weeks by Easter. So, that's a bit of a target for us as a city to aim for, but I think it's eminently achievable. And then, as you quite rightly say, once we get to that point, we'll pause the first doses and go through everybody's second dose. You're also quite right that extremely vulnerable people do benefit from this vaccination in a much greater way. Data published this week, so this data is in the public domain, would now suggest that for every 20 vaccinations we give in a care home, we prevent one death. So just think about that for 1 second. That is a phenomenal impact. As a GP, I don't think I've ever administered any treatment ever in my career that would have as great an impact as that. So for every 20 care home patients we vaccinate, we prevent one death. So that's what we're going to be focusing on, Jason, but we'll try and get through all those high risk priority cohorts before Easter.
Yeah, that's a tremendously important bit of information, Mike. Thanks very much for giving it to us. Fiona, another one that's been trending a bit on social media is, why can the little ones go to nursery when the big ones can't go to school? And I wonder if you can talk about that relating to early years settings for us.
Yeah, so the evidence shows that obviously children themselves, the younger age groups are less impacted themselves by coronavirus. Obviously, we know that the staff working in those settings, will be concerned, and and they're having to work with those children. All nurseries, as schools do as well, do have strict protocols in place in terms of how they minimize the spread of infection in those settings. So nurseries do have those procedures in place, and it's a really difficult balance, and we do appreciate this, but the impact of not having nurseries open in terms of key workers being able to go out to work, so we need to have those settings open. And and also just kind of thinking about the children themselves, and in terms of those very young age groups, what they miss in terms of being in those settings, in terms of the input, in terms of their development, socialization at those early stages is really key. So there is always an important balance that we have had to make throughout this pandemic in terms of protecting people in terms of the public health impacts, but also looking out for their general well-being in terms of other factors, and that's what largely has led the decision around keeping nurseries open, in terms of keeping the economy, keeping those key worker groups out to work, and also the social development of children at that age.
Thank you, Fiona. We've got a question for Nigel that's just come in from Jerry, and it's about carers who work in independent living schemes. They're not people in residential care, but home care people. So would you like to try that one, Nigel?
I think it's about vaccination, so it might be better to be Mike. I think if
Right.
Vaccination,
Okay.
residential care isn't what it used to be.
It is about vaccinations. Yes, I'm sorry, I missed the key word, didn't I? Yes.
Yeah, that's fine, Carol. So obviously, Jerry, we want to try and vaccinate anybody who has a caring role, because they're clearly very crucial in the lives of the people that they care for. So they will be prioritized in the carers list. And as I mentioned earlier, we're going to see an expansion of vaccination services specifically for health and social care workers and carers. And that will come on stream over the next couple of weeks. So you'll see that. And you know, one of the things that I think will happen is that the council will be given, well, in fact, all employers will be given the links to book in to have their staff vaccinated. So we're just finalising exactly how that's going to work. But that information will come out very shortly, and we'll be able to get to all health and social care staff and carers. And, you know, ultimately down the line, I'm sure we'll be adding lots of different employment groups to that scheme so that we can protect as many people as possible.
Thank you, Mike. Right, we will go back to Nigel now, and this is about council taxes increasing and council tax support, which Pauline might want to pick up after Nigel's answered. So what about council tax increasing, Nigel? Why is it happening?
I think there's been a lot of conversation about this, and it was touched on the last time at Facebook about why, with inflation at low levels, why is council tax continue to increase? And I think we need to look at the two different components that are making up the council tax increase. So while there is a 1.99% increase on general council tax, the vast majority of that is the 3%, what's called the adult social care precept. And the issue that we have is the vast majority of our budget, nearly 2/3 of it, is around social care for vulnerable adults and vulnerable children. That is not impacted by inflation in the same way that the cost of goods and sales are. The reality is that the money we have to spend to look after adults is increasing. The number of adults that are requiring our support is increasing, and that's exponential. That's not in line with inflation. Each individual that comes into the system adds significant cost, and that is why that 3% is necessary. The reality is the way adult social care is funded in this country is something of a flaw. We've been waiting nearly 7 or 8 years, I think, for the latest government white paper in terms of how adult social care should be reformed. Council tax was, as many people may remember, a stopgap solution to the poll tax crisis that was created some time ago, and it's remained ever since. It certainly was never meant as a long-term way to fund adult social care, and we really are calling on government nationally to step up and do as Boris Johnson promised when he was elected, to actually get that social care reform through and actually set up a system, working with our colleagues in health as well, to really get an integrated health and social care system funded properly that allows people to do that. At the moment, that sort of 4.5% increase in spending power that the Chancellor was talking about for local authorities, that burden is falling on local taxpayers, unfortunately. £12 million of the pressure that we're facing as a local authority coming into the next year, the vast majority of that is adult social care and children's social care. That probably takes up 70 to 80% of that increase. That's why that particular increase is there. We are doing everything that we can do to mitigate that impact. So we've taken as many savings as we can, £8 million worth of savings to offset some of that cost, taking that predominantly almost 50% of that from back office functions. But unfortunately, the way the government is currently structuring adult social care is passing that burden onto council taxpayers, and we will continue to lobby about that. And I think, as Pauline might be able to go into more detail, we have acknowledged that it is a regressive taxation. It is something that impacts negatively, disproportionately on some of our people who are less able to support it. So we have put additional funding in our budget in to help those people on low incomes. And there are a number of schemes that do help those who are really struggling in terms of council tax. And we continue to invest in that. I think maybe Pauline might want to expand on some of those schemes.
Yes,
Can you do that, Pauline? And can you also talk about support for council tax? Because that's another question.
Yes, absolutely. And the council's put an additional £1 million into our hardship funds to support residents through this difficult period. And I'll talk about how we've used that to support council tax shortly. The government did give us £1 million to help those who, whilst they're on benefits and receive what's called council tax support or council tax benefit, they still do have to pay some council tax of some kind or other. So the government gave us funding in April to pay up to £150 towards any remaining council tax bill. So for many, that means that they're not paying council tax in this financial year. However, the funding was only sufficient until October, and so the council has used its hardship funding to supplement that. And we anticipate that we'll be spending up to another £60,000 on assisting those that can't afford to pay their council tax this year. So quite a significant contribution. But the £1 million is going towards supporting people through our York Financial Assistance Scheme, our emergency scheme. It also helped to fund the October free school meals. It supports our work we're doing on supporting residents with digital support, with phones and data, and also supports the community hubs with food packages. So quite a significant range of support that is funded by the council. Thank you.
Thank you. Fiona, I'm going to sort of composite the some questions for you, and it's about people moving about. So first part, where can people go to exercise? Can they go up to the North York Moors and take a day out up there or not? And the second one is about Uber cars coming in and out of York. Are they transmitting infection as well? That's a question we've had coming into us this afternoon from Mike. Okay. So if you could tackle those two, Fiona, I'd be very pleased. Thank you.
Yeah. So exercising, unfortunately, the government guidance is a bit grey on this, and it doesn't very specifically say what you can and can't do in terms of where you can exercise. It talks about stay local, but isn't very specific about what local means. So our advice in terms of public health, the lockdown at the moment is all about minimizing the number of people that you come in contact with. So staying local for us, we would advise, you start your exercise if you can, walking from your door and you're returning back to your door. Obviously, it does depend on where you live and how easy that is to do. So if you do find that you have to drive a short distance to get somewhere where you can go for a walk safely or in an environment that suits, that's fine. But long trips, I would say, are probably not something we should be doing at the moment, so should try to stay very local. And in terms of people travelling into work for York, again, the guidance does state that if you can't work from home and you have to leave the house for work, then you can still do that. And if you have to travel to a different town or city for your work, then you are permitted to do that. So, and in particular relation to taxi drivers, obviously we do expect that taxi drivers, they have safe working practices in place, so they should be, sanitizing their cars, handles, that kind of things, frequent touch points. And taxi drivers are one of the groups who we have offered our rapid testing for as well. So if taxi drivers want to be tested, they can access that, so that they would pick up any early infection by being part of that testing regime as well. But it is allowed under the guidance to come here for work purposes.
Thank you, Fiona. Nigel, you want to add something?
I think it's just a bit of that clarity. So it's obviously that concern around Uber drivers travelling in is something that we have as a local authority raised. And I know that my colleagues and Councillor Aston himself has been in contact with North Yorkshire Police to examine what particular regulations there are around that. And I think the advice has been, as Fiona suggested, that if they're travelling for work at the moment, that is permitted. But I do know, I think Councillor Craghill as Executive Member for Safer Communities and Councillor Ashley Mason as a Chairperson of the Licensing Committee have also written to the Home Office asking for them to look into that and see whether there are further steps that can be taken. But obviously at this period we're bound by those regulations.
Thank you for that. Mike, please. This is about hospitals. We hear that the hospitals in London are absolutely overflowing, and we've heard about people being stacked up after they have passed on, which is very upsetting for people. So should we really not contact the hospital or not go to A&E? And what's the situation in our hospital, York District Hospital, now?
So you're absolutely right, Carol, that we're hearing nationally that the hospitals are under significant pressure. And I think the figure that I'm hearing is that they've got 50% more patients in them than they did this time last year. And we know that hospitals are always incredibly busy in winter. So to imagine that situation with 50% more people in hospital, they must be under enormous pressure. And I know in York, they've had to open up more beds for COVID patients this week. They've got significant numbers of COVID patients, and they've seen that increase since Christmas. They've got their ITU is incredibly busy, and I think what I would say is I think we can see that they're doing an amazing job. The dedication and commitment of those frontline hospital clinicians is just phenomenal, actually, and we can all see that. And I think I and I'm sure everyone on the call will join me in feeling incredibly grateful for what they're doing. So I think that really just we have to think about how we use those services. Of course, non-COVID illnesses still continue. People don't stop getting ill just because we've got COVID. So people do need to use hospital services, and they do need to use general practice. And I think it's just about understanding, just making sure that we're using them in the appropriate way. And general practice has changed how it's worked during the pandemic. We're doing a lot more, in fact, pretty much entirely remote access to start with, so telephone calls or video consultations. And actually, we can usually assess patients pretty well through that mechanism, and then arrange to see them face to face if we really need to, and it's going to be beneficial to them. And what I would say is that I've noticed that people have really worked with us on that. The public have been really, really good and really, really understanding. And I think at times like this, it just gives me an opportunity to say thank you to them for the way they've worked with us during the pandemic. And it feels really positive, and let's hope we can continue working in that way as we move forward and emerge from this really difficult time.
Thank you for that. Nigel, you wanted to add something?
Sorry, Carol, I think my hand's just up from last time about Uber.
All right. I think you make a really important, Mike, point that illnesses go on, accidents still happen, and people mustn't stay at home and keep their injuries to themselves or their concerns to themselves. Cancer still in the community. People still need treatment for it, diagnosis and treatment, and that is there and will be given if it's needed, won't it?
Yeah, absolutely. I think we're committed to that, and that's what we're there for. And we absolutely want people to get in touch with us. And in fact, one of the things that in York we've recognized is that business as usual, general practice has
Yes.
to continue. And that's why the practices have worked together to create the mass vaccination site at Askham Bar. It's what it's doing is it's protecting general practice to enable it to continue to be open, to continue to provide services for patients, and hopefully to not build up disease and illness and misdiagnoses whilst we're dealing with the pandemic.
Right, that's fine. Now we've got a question from Chloe, where I think I'm going to start off the answer because it's about nursery funding, and this is a hot potato at the moment. We've got a number of early years settings that are threatening. Well, not threatening. They're saying they might go down because at the moment nurseries are funded on attendance. It's not a fund which they get whether they have 20 children or 40 children. It's counted the number of children, and it's a per capita fund, and that's causing some problems with some of our early years settings, which are fairly vital for people who want to go to work. Pauline, did you have something you wanted to add, and then Nigel?
Yes, it's something we can take into account in our discretionary business grant scheme. It's fortuitous that we're still forming that to go to Councillor Ayre's decision session next week, and certainly we supported them in the first lockdown. I can't comment on funding, but in terms of assistance, we can certainly have a think about that.
Thank you for that, Nigel.
I think it's probably just to echo some of the comments that you and Pauline have made. Nurseries really have been put on the front line of this pandemic, and really are key to supporting many of our key workers and people do that. And they are being put under huge financial strain. As Pauline said, we do have a little bit of opportunity with some of the discretionary funding to provide some level of support. I think it is something we really do need to grasp nationally as an issue. And I know Councillor Owl, as our exec member for children, has been pressing government for action on this. I think it's time, and it's another area where we really need to step up and take a proper approach and make sure they have the support that they need.
Yes, absolutely. It's a vital service which people tend to overlook. Now, I want to go back to people who are isolating, and I think this will be a question for Mike and Fiona, and it's about people's mental health. We talk a lot, and we have talked a lot today about people's physical health, but it can be very depressing, very isolating to stay in the house on your own for a long time. And people want to know what they can do to buck themselves up when they're feeling a bit low. And they wondered if we have any suggestions. Mike, will you start? And then Fiona might wish to comment.
Yeah, I'd love to start. And I know Fiona will probably talk about some of the schemes that the City of York Council have in place, but I think what I'd like to focus on is just the impact of it. You know, we definitely don't underestimate this. It's been a really challenging year, whether you've been someone who's been asked to shield, or whether your work pattern has changed, whether we're now in many cases not able to see close family. We're all affected by this, and it does have an impact. And what I'd like to do is signpost people to a really useful resource on the NHS website. So if people just Googled 5 steps to mental well-being and the NHS, it takes you to a really useful site, and it's got obviously 5 steps there. And the first one is, and Carol, actually, you mentioned a lot of these right at the beginning. So maybe some of them are just common sense things, but there's a lot of evidence behind them to say that they work. So the first one is just connect to others. Make sure you ring your relatives. Let's use these virtual platforms like we're using now to connect to people, to have those conversations that we would normally have face to face. It's really important. You mentioned physical activity. Exercise is critical. And during the first lockdown, I know we surveyed our patients at Haxby Group practice, and we got 5,000 text messages back from patients to say that they were increasing their exercise and doing more, and that they were going to continue that because it made them feel so much better. Learn new skills, hobbies, just simple things that occupy your mind, whether it's reading or crafts or computer skills or whatever it might be. but just do something to keep your mind occupied. And the fourth one is give to others. Now, often when you say give to others, we think about voluntary work or helping vulnerable people in your community. And of course, that's really difficult now we're in lockdown. But it can be something as simple as saying thank you. Saying thank you to people you work with or people you know for what they're doing can be really important. Something as simple as just telling family members that you love them. Just that emotional connection makes a difference. And then the final one is something we've probably heard a lot about, and it's mindfulness. It's being in the moment, enjoying what you're doing at that time. Don't get sucked into watching the news all the time, because it can be quite the information that we get can be quite it's quite difficult to deal with. Be embraced in what you're doing with your whether it might be something you're doing yourself or with your family. Be in that moment and enjoy that moment. So have a look at that website. It really is effective, because it is important that we keep ourselves as mentally healthy as we can, moving through what's going to be what's going to continue to be a difficult period.
Yeah. Fiona?
Yeah, so I think one of the things I would say first off is, if you are struggling, not to feel ashamed of that, or to feel that you can't tell anyone, that you have to keep that to yourself. So one of the really important things is to talk about it and to reach out, whether that's to family members, friends, or if you really feel that you can't talk about it to people that there are organizations and helplines that you can ring if you would rather have that conversation with someone completely anonymously. So please don't feel that there isn't someone to talk to. And then just following on from what Mike was saying, around the 5 ways to well-being. So yes, have a look at those resources, and then if you're thinking, well, how do I actually do that sat in York? I don't know, I've not done any physical activity. I don't know how to go about it. I don't know what groups or resources there might be, or if you're feeling that actually I do want to connect with other people, but I don't have a good social network within York, and I don't know how to do that. If you look at the livewellyork.co.uk website, on the home page, there is a tab called COVID-19 Solutions. And that just gives lots of resources, whether it's links to local groups. So staying physically active is one of the topics. So various groups who are doing sort of online physical activity sessions, if you wanted to join in with any of those, some ideas about how to do that. There's a section on COVID-19 social contacts. So we have various groups who will do things like giving you regular phone calls, doorstep chats, that kind of thing. So if you're kind of wondering how to get started with any of those 5 ways to well-being, there's lots of sort of advice and local resources on that website to help you.
Thank you, Fiona. Nigel?
Thank you, Carol. I just wanted to chip in, as it's one of the areas that's close to my heart. It's an area that I've worked in for a long period of time and something I'm really passionate about. And I think I always go back to that mantra that there is no health without mental health. It's not something that can be separated. It's absolutely core to everything we do. And I think it's as much about creating a positive mental well-being as it is about focusing on the problems with mental health. We all need to be concentrating on trying to get a more positive outlook and a more positive mental health. I think I always tell the analogy, I think as Mike was talking about mindfulness, it was something that it took me a while to understand. And I think it dawned on me one day as I was walking through town. Beautiful sunny day, I'm walking past the Minster, and I was scrolling through Twitter, reading some of the most negative comments that you possibly can. And I sat thinking, every day I walk to work, every day I walk past one of the most beautiful buildings in the world, and I'm not seeing it. All I'm seeing is the negativity that's coming through my phone. What I need to do is just put my phone down, walk through the city, enjoy the sunshine, enjoy my surroundings, and really be aware of some of that positivity and not always focus on the negative. And I think also to flag that it's an area that we've highlighted in the budget, so we will be putting an extra £100,000 of investment in supporting some of those low-level mental health interventions through the voluntary sector, etc., to make sure that those people who are really starting to struggle a little bit with their mental health and some of their positivity get the support they need then to enable them to become significantly better and not necessarily need the levels of intervention that Mike and the NHS do provide.
Thanks. And Mike, even a walk can do it, can't it? Just walking around, nodding to people as they go past you on the other side, getting a bit of fresh air, even that will help, won't it?
Yeah, absolutely. You know, just a minimal amount of exercise or just getting out, change of scenery, keeping yourself mentally agile, it definitely helps. And I would just give, you know, one more bit of advice is and Fiona alluded to this, that, you know, thinking about your well-being and recognizing that you do have vulnerabilities is not a weakness. It's an absolute strength. And, you know, the people who can do that and really do look after themselves do see the benefits from it. And finally, what I would say is, if you are struggling and you've tried some of these low-level interventions and it isn't working, then please do seek help. And you know, general practice is there for you. I said earlier that we're very accessible during the pandemic. Lots of practices have online access now, or through the usual routes through phone access, and we are there for you without any question. We are there for you.
Thank you. We're nearly out of time. Does any member of the panel have a last comment they wish to make? No, I think in that case, I'll, with an eye on the time, I'll draw it to a close. I think I would say, if you don't know what number to ring, just remember 551 550, and somebody on the end of the line, whatever the problem is that you've got, and it doesn't matter whether it's finance or physical health or mental health, they will point you in the right direction. 551 550, the council's helpline. Very, very useful. So I'd like to thank everybody that sent us in a question. That's been really good. And everyone who has answered a question. The panel has been very adaptable and flexible with the variety of questions that we've had this evening. We will have more Facebook Live Q&As. So thank you to our panelists this time, and watch out for more Q&As in the future. And people who are watching, send your questions in, just like people have today, and the panel will do their best to answer them. So those comments can be, and questions can be left on our Facebook page, and people will get back to you quite quickly. We're expecting to have more Q&As on public health updates, and probably more on some of the topics that have been discussed today, because we are working in a very fast changing environment, and both with grants and with the pandemic advice, sometimes it needs a bit of interpretation. So we'll hope to be able to do that for you on future occasions. So finally, thank you to everyone. Thank you for joining us, and have a great evening. Thank you. Goodbye.